Hi, you're watching Fascinating Sports, and this is the start of a 3 video series which will discuss one of the common sports injuries, that is, knee injuries. In this first case, we are going to talk about how the knee joint looks like, how much and which direction does it move, and how the injuries can happen. So, knee joint can move only in one direction. In the opposite direction, it can barely extend, say about 5 to 10 degrees. More than that, it cannot, and if it does, then it definitely causes severe injuries. This direction, this opposite direction of movement, is called as hyperextension. Hyperextension injuries happen in sports when there is wrong footing, or when by any chance the player, the athlete, happens to strike against something with his knee by a fall, or sometimes by a collision with the opposite team's player. In case of hyperextension injuries, the damage is to ligaments, tendons, and bones, and sometimes the bone itself. Muscles are often and always injured, and hence I did not speak about them in the beginning. The joint is covered around by muscles. It is composed of bones, and the muscles are connected to the bones by means of tendons, and the bone itself is connected to each other by means of ligaments. Muscle injuries are very common. Following muscle injuries is the injury to the tendons and then the ligaments. Muscle and tendon injuries can recover over a period of time by simple measures of rest and reducing anti-inflammatory conditions. Sometimes there may be a surgical intervention required if the injury is very, very severe. The next is an injury to the ligaments. Now, ligament is the most crucial part of any bone or bony system. It connects two bones and maintains the dynamic structure of the joint. In case of the knee joint, most common injuries are the meniscal injuries, which is the damage to the bone at its surface on the edges, and the tear of ligaments, the anterior cruciate, the posterior cruciate, and the lateral and the medial ligaments. Now, these injuries are graded as grade 1, grade 2, and grade 3. Grade 1 injuries are those in which the ligament is injured very, very small bits in places and can be recovered through rest over a longer period, unlike the muscles and tendons. Grade 2 injuries involve a greater damage which needs some surgical intervention, may not also, but a lot of rest. And grade 3 is when the ligament is completely torn and it needs a repair, which is only and only possible by a surgical intervention. Other than this can be not treated by any other means. The following videos will take care of more detailed medical aspect of these injuries and how you can manage these injuries at home in your rehabilitation phase after surgery in grade 3 or grade 2, and without surgery in grade 1 and grade 2 with minimal medication and minimal